So,
the one that made Ronnie look funny?
yes, exactly. You're exactly right. Now, first of all, everybody, I want to welcome everybody to the Trigger Point Workshop. It's a pleasure to have everybody here together. Like you know, everybody should know me. Some people are guests here, and I appreciate all the guests being here. I'm Dr. Vincent Adamo, and welcome to Live Holistic. Today we're going to be teaching you how to find trigger points, how to work them out at home with your partner, so you can understand not only what a trigger point is, but how you get rid of it, right? So it makes a big help with your care when you're actually actively helping yourself at home. So we know that most of you guys are coming here to get yourself healthy, get yourself strong. We're going to relieve subluxation. We're going to make sure that pressure is off the spine, off the nerve system. But we want to make sure that you guys know what to do at home. So what? You can stay healthy when you're not here, okay? So it's always great to learn. Everybody knows that knowledge is power, and for the lack of knowledge, people perish. So the more knowledge you have about your body, the more knowledge you have about your health, the more knowledge you have about how to take care of yourself, the healthier, the stronger, the longer you're going to live, right? And that's what everybody wants here. Agree, right? We want to live healthy, we want to live strong. And what we want to make sure is that we stay away from who? We want to stay away from the medical doctors, right? We want to make sure that we're not taking drugs, right? We're not just masking symptoms, right? We're not doing surgeries. We want you guys to understand, you know, one of the main purposes as me as a doctor and an educator is to make sure you guys understand that the body was created to heal itself, right? There's a power that's already inside here, and we want to make sure that it's expressing every single day. And the way that we get that power to express is making sure that your nerve system is functioning at 100%. Now, there's one organ in your body that controls everything, and it lays up in your head. What organ is that that's in your head? It's your brain, yeah. And your brain controls your whole body. Now, most people don't know this, but how does your brain control your body? Right? Through your nerve system. You're exactly right. So every second of the day, your brain has to communicate with your body. And we're gonna grab Peter here. And every second of the day, remember your brain sits up top here and it's sending messages and signals. Mental impulses are getting sent down your spine, out the nerves, to every single organ, tissue, and cell in every single part of your body. Now we want to make sure that that system's functioning at what percent do you think? What do we want that functioning at?
100%.
100%. And if it's functioning at 100%, do you think you're going to feel good?
Yes.
Yeah, number one, most people want to feel good, but I want everybody not just to feel good, but we want you to function well. Function is what we're looking for, okay? Some people feel good, some people have aches, have pains, but when you have proper function, you're going to feel good. Does that make sense? So we want to make sure the nerve system is functioning at 100%. Most people don't realize is that when your spine, if it shifts out of position, right? So from stress, lifting, bending, twisting, accidents, slipping and falling, the birthing process will cause our spine to move out of its normal position, okay? There's a word for it. We call it what? It starts with an S. Subluxation. Okay? Subluxation is when your spine shifts out of position, and what's going to happen to the nerves if the spine moves out of position? It's going to start putting pressure and damage or pinch the nerves. Now, what if that nerve was controlling your upper back? Right? What if it was controlling your stomach? Right? If that nerve has pressure on it, do you think your stomach could function at 100%? No. And is the answer just to feed the stomach more drugs? No, that's not getting to what? It's not getting to the cause of the problem. That's only fixing the symptom. So we don't want to just fix symptoms in this office. We want to fix the cause. And that's what we're looking for. So if you have subluxation, that's what's causing the body to break down. When we fix the subluxation, now your brain can start relaying the messages, and that power can start to heal your body the way it's supposed to. Without drugs, without surgeries, right? And I know a lot of the patients that are sitting here, if some of you guys have been patients for months, know that already. Like, you've had great results in the office, and we didn't give you any drugs, right?
Not you.
So we want to make sure that what? Your body heals itself, okay? If we remove the interference, I promise you the body knows what to do, right? I mean, God put the most amazing healing power inside this body. And if it's being expressed the right way, your body's going to do exactly what it needs to do. Does that make sense?
Yeah.
So subluxation causes trigger points. Poor posture causes trigger points. Some of you think, well, how do I get these knots? How do I get these tight muscles, right? Poor posture, number one. We always tell you here, posture is the window to your spine. Some people see people walking around like this. Do you really think they're healthy? Right? Or if they're walking around like this, do you think they're healthy? I know that their spine's out of position and causing damage to the nerves. So posture number one is the window to your spine. We want to make sure you have proper posture. This workshop, I'm going to kind of be quiet in a little bit because I like to do hands-on. This is a more hands-on workshop, so I'm not going to talk for too long. Okay? We're going to get right into it. Okay? This workshop is all about finding the tight muscles and learning how to work them out with your partner. Okay? So we want to make sure that you're subluxation free, number one, because if you're subluxation free, your trigger points will be less often. They won't happen. Okay? Because if you have subluxation, everything's going to get locked up and get tight. But when we relieve the subluxation, it all should release. Because the muscles should stop knotting up. Okay? So I want you guys to understand, we're going to go over what a trigger point is. So the purpose of this workshop is to show you how to release, how to find and release the trigger points. Okay? So trigger points are areas of muscle that have spasm or tightness. Okay? So that's what we're going to be looking for today. We're going to be scanning each other and finding the tightness in their muscles. And we're going to teach you how to work them out. Okay? They occur as a result of the irritation of the nerve system, which I just went over. Right? If you have subluxation, you're going to expect to have trigger points. You're going to expect to have tight muscles. If the nerves aren't functioning at 100%, the function is going to start to go down. And the answer is not medication, right? Most people would say, oh, just take Advil or just take aspirin. But most people don't know the side effects of medication. Now, a lot of us watch TV and we see like a lot of the drug commercials come out on TV, and what happens? The last what? About 30, 45 seconds of the commercial is what? All the side effects to the medication. So in this office, we try to help you stay healthy naturally and stay away from that area. Okay? I'm not saying that drugs are, I am saying that drugs are bad, but there is a purpose for them. Okay? But the purpose is for an emergency. It's not something to take long term. Does that make sense to everybody? So when they put you on a drug, how long do they want to keep you on it for? Years, most likely forever, okay? That is unacceptable here in this office. And we help so many people in this office get healthy naturally and come off medication. Why? Because when we work on this power, when we work on this system, the body knows how to heal. It knows what to do, and we're able to get you off your medication and keep yourself healthy and well, okay? So every muscle, organ, and tissue has a nerve root that controls it. So everybody understands that there's nerves that go to every single part of your body. There's miles and miles of nerves in your body. Okay? The nerves carry communication from the brain to the body and back again through the spine. Make sense so far? When 100% communication occurs, one has 100% function. Does that make sense? When your brain is communicating with your body at 100%, your body has an ability to function at 100%. Make sense to everybody so far? Okay? 100% function equals 100% health. Okay? So what I want to do is I'm going to skip through some of this stuff, okay? So we're going to go through, I want to go right to the most common trigger points. So now let's look at the most common trigger points. Most people don't realize that the most common trigger points are in your neck and shoulders. The number one area to carry stress is up in your neck and across your shoulders and your trapezius muscle. And if you see on the TV here, your traps actually go all the way from the outer part of your shoulders up to the base of your neck, all the way to the mid part of your back. That's the most common area where people hold stress. Another very common area people hold stress is their lower part of their spine, their lower back. So we're going to check each person here today. We're going to be going with you and your partner and teaching you, God bless, where you have your trigger points. We're going to show you how to find them. We're going to teach you so you understand what they are. But the biggest thing in this office right today during this workshop is communication. Okay? It's so much easier when you have your partner telling you, yeah, there it is. There it is. I feel it there. Or they're just being quiet, not saying anything. It's hard. Okay? You guys, this is your first time doing this. Communication is key. Communication is key for anything, right? It's one of the most probably the best thing for a marriage or a couple is communication, right? Same thing for anything, any part of your health. Making sure that you're communicating with your spouse or communicating with your partner or your friend is huge with this workshop, because we're not experts. I went to school for 7.5 years, but you guys aren't experts at how to find trigger points, and I'm going to teach you in 15-20 minutes how to find them. So communication is key. If you know you feel tightness in your shoulders or your neck, you most likely have trigger points there. If you know that my legs are super tight, you most likely have a trigger point in the calf or the leg muscles. So we're going to be communicating with each other, okay? So I'm not going to just, I know how to do this, but you're not going to just have your partner just start touching you. You're going to tell them, hey, work on my low back, right? A lot of people already know the areas that have tension or have stress. And we already know the most common is probably the neck and shoulders. A lot of people will say, my neck and shoulders. Make sense so far? Yeah. Okay? So trigger points, these trigger points, most people don't realize is that trigger points can cause so many different symptoms, okay? Headaches is one of them. Headaches is a huge, huge thing for people. And most people don't understand that if the normal amount of headaches you're supposed to get a year is 2, okay? If you're getting more than 2 headaches a year, there's something wrong, okay? There's something interfering with something, okay? And the answer isn't just to take Advil, okay? Because Advil, after a while, what it will do, it will eat the lining of your stomach, it will cause ulcers, it causes bleeding, right? And it's not good for you, okay? God bless. So we want to make sure that you guys understand that it could be coming from something physical, okay? So if you have physical pressure on your nerves, how do you get rid of it? By physically working on you. Why do you think a lot of you are responding to this care? Because you have physical damage to your body, and I'm physically working on you, right? If you had a chemical problem, chemicals would take care of it. Most people don't have chemical problems. They have physical problems. But a lot of people try to do what? Fix physical problems with chemicals. And that's a slippery slope, because then you have to take the chemicals forever, because it never gets to the cause of the problem. Does that make sense so far? Okay? So let's go over it. So we're going to go over trigger points in your low back, your buttock, your legs, your calves, okay? We only have time today to concentrate on a few trigger points, so decide which area you would like to be worked on, okay? So I'm going to stop here because I want to get right into the hands-on, okay? I need a volunteer, okay? The first thing we're going to do is I'm going to have a volunteer, and I'm going to teach you how to look at somebody's posture. Because remember, posture is the window to your spine. Because if somebody's standing here like this, you know that their spine's out of alignment, there's subluxation, and there has to be tight muscles and trigger points in an area, right? Does that make sense? So we're going to teach you first how to look at posture. Does that make sense? Because if you look at your partner's posture and you notice that they're all tilted or out of alignment, then you're going to know exactly what areas to focus on first. Then I'm going to have you guys lay down or sit in the chairs, because a lot of people have trigger points, like we said, most common areas, neck and shoulders, so you could do it in a chair. So most people that have low back complaints or have leg complaints, we're going to use the tables for you. And if you have a lot of neck and shoulder complaints, we're going to be doing chair work, okay? So sitting in a chair. Does that make sense? And feel free to move all the chairs around once we get up and start doing and getting into the work. Don't worry about the office. Make yourself comfortable and make yourself, you could scatter around to make sure. Myself, Christina, and Ronnie will be going around each person and showing you if you have the right area or if you have questions. But the main thing first is communication with your partner. That's why we have you have a partner here, number one, because you're going to be working on each other. But communication makes it so much easier to find what you're looking for. Make sense? So who wants to volunteer? Not everybody at once. Okay? Come on up. Okay? So I'm going to have you actually stand right here. So you're going to stand just like this. Ronnie, you got this here? Mm-hmm. So what we're going to do is we're going to observe. Okay? We're going to observe her posture. So the first thing we want her to do is kind of get out of that stiff mode. So I'm going to have you march in place for about 10 seconds. Okay? Close your eyes, march in place. And if some of you get a little dizzy, don't close your eyes, okay? So just make sure we don't have anybody fall. So now you're going to stop and look straight ahead. So the first thing we want to look at is we want to look at the shoulders, okay? So I'm going to come over here. So we want to look at the shoulder height. Can everybody see her right now? Does everybody realize that this shoulder is a little bit lower than the other shoulder? Yeah. Okay, because everybody can see that, first of all, right? Now, you're not experts. I noticed it right away. I've been studying this for years. But you'll notice that her shoulders is a little bit lower on her right side. So I know that the muscles have to be tight in this area. So we're going to be checking her for trigger points in her upper part of her spine, in the traps, okay? We also want to look at hips. So we come here, we can feel the top of the hips. Make sure the hips are in alignment. Now she just got a great adjustment, so her hips are actually in pretty good alignment. Okay? You also want to look at people's feet. So her feet are actually pretty straight, which is great, but you'll see people, they flare their foot. They stand and they're standing like this. Meanwhile, they're marching and all of a sudden they stop and their foot goes like this. So you'll notice in the buttock and in the legs there'll be trigger points. Does that make sense so far? Okay? So I automatically know, just by looking at her posture, that she has something going on in this area. Now, we knew on her x-ray there was subluxation there, for sure. Okay? But we want to make sure we take care of the muscles. We want to make sure that we relieve the stress out of the muscles so the spine can move back into position. So remember, the reason you're coming here is to get the spine back into a normal position to relieve your subluxation. But it's a lot easier for what? When the muscles are relaxed, right? So that's why I work on your muscles before I adjust you. So I get them to relax and calm down so that spine can shift back to normal in that area. Does that make sense so far, guys? Okay? So we're going to have her sit. Have her sit right here. Okay? So it's very easy to find trigger points. Now the first thing, like I said, is communication. We all know how to look for posture now, so we're looking at what? The shoulder heights, we're feeling the hips to make sure the hips are in alignment, and we're looking for the feet to flare out, okay? So we know that there's a trigger point in her shoulder. Hi, Teresa. Come on in. Just go ahead and sit next to your lovely husband over there. Okay?
Well, he didn't come, so I'm here.
Who has a sense of humor?
Okay, so
Funny sense of
the
humor.
best way, like I said, is communication. So a lot of times you just want to be, now the softer your hands are, the better, okay? You do not want to be too powerful with this, okay? Because trigger points, they hurt. They don't want to be touched, okay? So the softer your hands are, the easier it is, and the more that you'll actually like doing this work, okay? So the first thing we'll do is we'll scan. We'll feel the spine. We'll scan it, okay? And we'll see exactly, hello guys, we'll see exactly where the pressure is, okay? So if I scan her back, and I'm just feeling here. So I'm feeling her back, and it's pretty loose on this side, but when I come through here, I can feel it, okay? Yeah, you feel that, right? So how you doing? Welcome. So we want to make sure, like I said, you're going to feel it when we find it, okay? When we find trigger points, you are going to feel it. But like I said, when we actually push on a trigger point, it actually causes a little bit of pain, but when you hold it, it actually releases all the stress out of the shoulder. So I like using my thumbs. My thumbs, the thumb pads are probably the biggest pads on your fingers, and I like using my thumbs, okay? So when I do it, like I said, trigger points I don't like to be touched, so I like to go in a circular motion to find them. So when I go to a circular motion, you'll kind of feel sometimes it will move because it doesn't want to be touched, okay? Remember, the muscle's very big, it can move on you. So when I come through here, we're going to find the trigger point, and I have it right there. So she feels it, and she's going to tell you, okay? So most times you're going to feel it, and the patient's going to, or your family member or your friend, whoever's here with you, they're going to say, yeah, you got it, I feel it. Ease up a little bit because these things hurt, okay? And that's why a lot of you have your pain, have your discomfort, why it takes so long for your adjustments to actually hold in alignment, right? Because the muscles are so tight. That's why you guys are on a longer care plan here, so we can release everything and make sure everything's in alignment. So when I find the trigger point, what we want to do is we want to literally push down on it, okay? Which is going to cause her some discomfort, but as I hold the trigger point, she's going to feel the whole muscle actually start to release. So the time that you hold the trigger point is 7 to like 15 seconds. So within 7 to 15 seconds, she's going to feel the pain start releasing, and actually will go away. Now you start to feel that?
Yeah.
Yeah. So it doesn't hurt no more. Okay? A lot of times what I like to do is I like to use both fingers on there. Because remember, you don't just have superficial muscles, meaning we don't have just muscles in the front, we have muscles that are very deep. Okay? So you have very thick muscles that go deep and deep. So sometimes you have to push a little bit to get to those deeper muscles. But communication is key. If your partner's telling, hold on, it hurts, ease up. Okay? If your partner's saying no, then I want you to tell them, no, more. Keep pushing, harder, right? So you want to communicate with your partner so you know exactly how much pressure to put. You know exactly that you're on the right spot, right? And you'll feel it release a lot easier when you're putting the right pressure, okay? So she may have 3 or 4 right in this area because they're small. They're like the size of like a dime. They're very small, but they can become like thick too. So I could scan her through here, and I'll find a couple. And here's another one right here. Yeah. So you're gonna find a couple of them right there. Okay. So there's another one right here, and I found it with my middle finger, but I like to use my body for this. So we don't want to put too much energy that I'm working on her, and then afterwards I need work done, right? So I want to do it to the point where you guys are using your body the right way, so you don't need the work right after you're working on your partner. It's always good to do the reciprocate, work on you, you work on me, right? But the thing is that when you're doing a trigger point on somebody, you want to make sure your body's relaxed, that you're not tightening up. You're not causing your muscles to spasm up. So what I like to do is I like to angle myself. So you're not going to see this too much in the running cut and just shift around a little bit. So I like to angle. So I know her trigger point's here, so I'm not going to lean all the way this way. I'm going to come this way, and I'm just going to push into it this way. So I'll push right here. She'll feel it. Feel it?
Yeah.
Yep. And I'll hold it. I'll put 2 thumbs on it. And in 5, 10, 15 seconds, she'll see it start releasing. You feel it?
Yeah.
It's starting to release.
Yeah. It doesn't
Okay. So it releases, and then we move on to the next one. Does that make sense, guys? Oh, so far, so good. Is there any questions so far?
Yeah.
Yeah.
When you're looking for it, how do you feel it? Do you feel like bumps or?
Yeah, you'll feel
She
the
has
notch.
that, and I can never
Okay. Well, that.
find it.
The good news is that you're both here, and we're going to help you find it. But a lot of times when you're scanning, like I said, I like to be very light when I'm just rubbing a spine or I'm feeling a spine. You'll actually feel one side higher than the other. Like there's some, like a little bit of inflammation in there. You'll go through her spine, and you'll say, oh, well, this this scapula feels really good, but I go to this one, oh, man, there's some tightness there. You'll feel the tightness. Then when you feel the tightness, you want to start going in circular, deeper. So you can feel, you'll feel the trigger point starting to move. And she's going to tell you, you're on it. Now, I know I work on your wife, and if I go to her low back, I go right on it, and she's like, oh, Dr. Vin, you're on it, right? Because I know exactly where I'm going, and the communication, too. Okay, now I know exactly where to go and what to do, but like you're saying, you're not an expert on it.
Yeah.
Communicating with your wife is huge. So she's going to tell you right away, Pat, my low back, okay, or my buttock.
Yeah.
Okay, so now you're going to start scanning right there. You're going to go flat hand. You're going to feel where the tight spots are, and she's going to say, yeah, right there, to the right, to the left. Oh, you're on it, right? So communication's key. It makes it really easy, okay, because you're not experts. I don't expect you to be experts after 15 minutes of learning this, but if you communicate, it's very easy to be an expert. And you also want to let your partner know what? Put a little bit more pressure. Push a little harder. Ease up, okay? So you don't want to hurt each other, but you want to make sure you're doing it good enough that you're releasing the stress. You're releasing the trigger point. Does that make sense so far? Okay. So let's get you to lay down flat on your stomach. So I'm just going to go over the low back once. This way, a lot of people that have low back issues or low back complaints will go over the low back. So the first thing is always to check, okay? So like I said, the scan is always easy. So when we come down, we're scanning to see if there's any tightness. I already know there's tightness up here, so we know that Shauna, when you work on her, you're going to work on her shoulders. But a lot of people, when you do, you come to the lower back. Now, a lot of times, I already feel there's already one in the lower back. But what happens is, a lot of times, it's not particularly right in the lower back. It's always the top of the buttock, right? The top of the buttock is really where a lot of people get trigger points, okay? It's called the piriformis muscle. It's the #1 muscle that causes the sciatic type of pain, the pain that gets in your butt down your leg, okay? So it's very easy for you to get that type of pain when you get tightness or trigger points in your lower back. So when I scan, I'm just feeling it. I can just press in, okay? So automatically, I already have it. I'm listening to the response. I press it on the right. She's already yelping that I know it's there, okay? So same thing. I scan with my hand, or I'll scan with my thumb, and I feel a pretty big trigger point right here. But she also had something going on here, so we're going to go easy for this area, right? So we'll go a little bit above it, and I feel a little bit of a trigger point right here, okay? So there's a trigger point here. I'm going to take my thumb on thumb. I'm going to start to push down. She'll feel it. And within 5, 7 to 15 seconds, she'll see it release. So you tell me when it releases. Yeah. So you'll see it release pretty quickly. And they're small. You might have 5 of them in this area. And you just keep scouting underneath your thumb. You'll feel it. And
It's better to press
I like using
as
my thumb.
opposed to kneading, you know.
Yeah, it's definitely better. When you find a trigger point, you want to hold it.
Okay.
You don't want to just go like this, okay? That's just moving it around. You want to get on top of the knot and you want to dig right in. And it's going to cause pain, it's going to cause a little discomfort, but within 15 seconds it's all going to be gone. 15 seconds, okay? Is everybody okay so far? So scatter around, okay, grab your partner. Some people with the low back complaints lay on the tables. People in the chairs, I want you to sit in a chair, but sit in a chair the opposite way where your torso is on the back of the chair so we can start working on the shoulders, okay? Ron, that's good?
Good.
Okay, just press the middle button.